Jonathan Nez. Mr. President, thank you for being with us. You just heard Sarah Seidner talking about the Sioux issues with the governor in South Dakota. You had a deal, you agreed when the governor of New Mexico shut down Gallup. Where are you now that that lockdown has been lifted? Is there agreement with the governor and the other political leadership, or do you have issues?
Hey, thanks for having us on the show, John. And, you know, we totally support the South Dakota, Oglala Sioux Nation and the Cheyenne River Sioux Nation. Chairman Harold Frazier, with his strong support for his citizens and to help, you know, take care of his people there. And I appreciate all the 574 tribal leaders throughout the country that are standing on their sovereign ability to help govern themselves and help keep their people safe. And we also appreciate other governmental entities like the city mayors of Gallup and Farmington, border towns around our nation. We are in 3 states, John. One, I want to say thank you to our governor in Arizona for, you know, assisting, and also the governor in New Mexico and the governor in Utah. That is partnership here, because we're all in this together. What affects the Navajo Nation affects the states and vice versa. And I'm hoping the South Dakota governor sees the same thing here. We all got to work together to help our citizens. And with the lockdown in Gallup, New Mexico, you know, Navajo Nation, John, has been in lockdown for some time with a shelter-in-place order since the onset of this virus over a couple months ago. And, you know, and we have a curfew as well from 8 p.m. to 5 a.m. during the weekdays. And during the weekends, we have the 57-hour curfew. We just coming off of a 57-hour curfew now, 5 a.m. this morning, to protect our citizens. Because of the slowness in the response from the federal government, we have to use our own sovereign ability to govern ourselves. And that's why we have to go as far as saying we're going to cut off traffic. We've been cutting off traffic to our Navajo Nation as well, and telling people our tourism destinations are closed. Please respect the sovereignty of our Navajo Nation. You know, we appreciate you coming back later after this public health emergency has gone away.
But Mr. President,
we're doing everything that in our power to help each other.
Sorry, I didn't mean to interrupt there. I think I misspoke about the numbers, but you have 3122 confirmed cases in the Navajo Nation, 100 deaths in the Navajo Nation. On a per capita basis, that is incredibly high. It rivals when you look at places like New York or New Jersey. I want you to listen here. This is from a CBS documentary. Your medical director, a member of your nation, who says, just like we just heard from Sarah Seidner in South Dakota, one of the concerns is that if you get a big outbreak, you don't have the medical facilities, the capacity to deal with it. Let's listen.
We don't have a lot of funding to lure some very experienced doctors and nurses and medical staff. We just don't. We do carry a high rate of diabetes, hypertension, what we call metabolic syndrome that incorporates those 2 things. And per capita, we actually have the highest rates.
Dr. Tom, they're laying out, you have some of the pre-existing conditions, if you will, on your nation there. What are you seeing? Are the people who are getting the coronavirus and dying of the coronavirus, are they people with obesity, diabetes, heart, underlying conditions? What are you seeing on the ground?
You know, John, we're seeing young people that don't have any type of health problems getting COVID-19. We had a couple of young people who've lost their lives because of coronavirus, and they were healthy. And so this virus is hitting everyone. It doesn't matter if you're Democrat, Republican, male or female, or different faiths. It is a virus that's attacking everyone. But here on the Navajo Nation, John, we have been testing very aggressively. And we appreciate the work of Dr. Tom and Winslow and many others out there. Vice President Myron Leiser have been on the front lines since this pandemic started, except for the 2 weeks we had to, be quarantined because we were close to an EMT that had COVID-19. But back to the tests, 18,153 tests that have been given, and 13,665 have tested negative. So we've been aggressively testing. our citizens here on the Navajo Nation, but it's, the virus just spreads like wildfire. We have 30+% of our Navajo citizens here on Navajo that don't have running water. We have multiple generations of family members living under one roof as well. And so the need for the federal government to reevaluate the needs of tribal communities throughout the country. And this is all tribes, 574 tribes throughout the United States of America. We've been giving aid to various countries when there's an emergency. Don't get me wrong, John. I'm sure the need is great for all these other countries when times of emergency. But right here in the middle of the most powerful country, the United States of America, the first citizens of this country are still being pushed aside. And I appreciate being on the show because it magnifies the need to bring full attention to tribal nations throughout this country and the need to bring better infrastructure. And in terms of the healthcare, it's not just on tribal lands. I think this pandemic, John, has shed light on the inadequacy of our public health system throughout this country, but more so here on the tribal communities.
Mr. President, greatly appreciate your